Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Tamsulosin. Its brand name is Flomax. Now before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Tamsulosin is an alpha-1 adrenoreceptor antagonist. By selectively blocking sympathetic nervous stimulation, it can cause relaxation of smooth muscle in the prostate, prostatic urethra, as well as bladder neck. This would improve urine flow and reduce symptoms of benign prostatic hyperplasia. In terms of indications for use, Tamsulosin can be used for the treatment of BPH, or benign prostatic hyperplasia. It can be used to treat disorders of the urinary system following a spinal cord injury. It can help with lower urinary tract symptoms. It's indicated to be used in radiation-induced disorders, such as urethritis. And finally, it can be used in patients who have a neurogenic bladder. Now, before somebody was to use Tamsulosin or Flomax, there is a contraindication, which in this case would just be patients who have a hypersensitivity to Tamsulosin or any other component of the product. As well, there are some precautions and warnings that they should be made aware of. Patients should be made aware that syncope may develop while using Tamsulosin, so they shouldn't put themselves in situations in which case syncope may cause danger for them. Postural hypotension, dizziness, and vertigo have all been reported with the use of Tamsulosin, so patients should be made aware. Patients with a sulfa allergy may be at an increased risk of experiencing an allergic reaction to Tamsulosin. Tamsulosin should not be initiated in patients who are scheduled to have a cataract or a glaucoma surgery. It's important that cancer of the prostate is ruled out before a patient starts Tamsulosin. Males should be made aware that priapism has rarely occurred with the use of Tamsulosin. And we want to avoid using this medication with strong CYP3A4 inhibitors, such as ketoconazole. Now, once somebody is cleared of that contraindication and made aware of the precautions and warnings, and they start to use Tamsulosin or Flomax, they can expect to receive their dose in capsule form. When somebody is using Tamsulosin for BPH, or benign prostatic hyperplasia, they would use 0.4 milligrams once daily. If there's no response after 2 or 4 weeks, then the dose can be doubled to 0.8 milligrams daily. It's important to tell the patients not to chew, crush, open, or alter the capsules in any way. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Tamsulosin or Flomax, so I'll go over some of those here now. 9 to 10% of patients using Tamsulosin may develop an infectious disease. About 7 to 8% of patients experience backaches. Dizziness can happen between 15 and 17% of the time. Headaches come in around 20%. Insomnia can happen between 1 and 2.5% of the time. And somnolence seems to happen between 3 and 4% of the time. 8 to 18% of males may experience abnormal ejaculation. And between 13 and 17% of patients may develop rhinitis. Some more rare but serious side effects would be retinal detachment or priapism. That's all we're going to talk about today with Tamsulosin or Flomax. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.